And that brings me to our amazing panelists. So we have, if you just wave your hand when I talk about you, we have David Hanna from Wesley Community Action in Wellington. David's been really doing some amazing creative work trying to create solidarity in the community sector and find ways to step outside kind of a funding cycle and things like that. We have Will Kaipo in Whangare, also doing very creative work with his organisation Tai Timu Tai Pari to really try and get above the everyday to the systems change, to think about how this all the systemic parts of the child welfare and criminal justice systems need to be changed to work better for whānau, basically. And I'm sure you'll tell us more about that when we get to you, Will. And then we have Jane Hutton, who's here in Ōtepoti, Dunedin. Jane is a manager at Anglican Family Care, many years of experience trying to marry the funding and procurement regime with the actual services to whānau, and has a real heart for working in that space. And they hold the Family Start contract, for example, here in Ōtepoti. So these are our speakers, and just in terms of format, so Cal will give a talk, and then our speakers will have a chance to respond, and then we'll open it to the floor for some questions. So over to you, Callum.
Thank you so much, Emily and Kerry. Thank you for the very warm welcome. While I'm sharing my slides, I will say two things. The first one is I won't be able to see any of the chat while I'm going through my slides. So if someone asks a very good question, I might not know that I can reply to it right away, but please do feel free to either put your mic on, or Emily, who's chairing, feel free to just chime in if there's a question that we'd love to hear the answer to. I'm really happy to be interrupted to answer any questions. And the second thing is my washing machine will go off probably about half an hour into the presentation. So if you hear a jingle somewhere off in the distance that goes on for a much longer time than any washing machine jingle needs to go on for, it's probably that. Hopefully it will get filtered out with the background noise, but yeah, that was very poor timing on our part. So investing in prevention and support. I want to tell you a little bit of a story about how this project got started, and then you can tell me whether that sounds familiar, or maybe our panel can reflect on whether this sounds familiar. So during the Child Welfare Inequalities project that I was working on with Professor Paul Bywaters and Professor Kate Morris and Breach Featherstone and all sorts of wonderful people, we kept coming across similar to reports saying, oh, it's nothing to do with poverty. Poverty doesn't play any role. It's all about families and behaviors and parenting practices and so on. We also kept coming across all of these reports that said it's not enough to just invest money. Local authorities, our municipalities here, aren't doing the right thing with the money. It's all about the quality of what you do. So Ofsted, which is our independent regulator, a sort of arm's length regulator of children's services, schools, and so on, they said very strongly in a report, their chief inspector said in a report, it's not about funding. Funding isn't the reason why certain children's services are not meeting our quality standards. Myself and Devara Bennett and Paul Bywaters did a different paper where it turned out actually it was linked to funding quite strongly. So that was one aspect of it. And we also had a big report by our National Audit Office, which was sort of this big, I think they're governmental body that looks at what other people are doing and tells them whether they think it's value for money or not. They're usually a little bit, shall we say, they keep their methods quite close to their chest. And they came to the conclusion that spending money on prevention, on support, on children's centres, on family support, doesn't have any kind of impact on child protection plans, was what they were looking at. And usually when you see something like that and it doesn't really make sense, it's not often because it doesn't make sense. It's usually because the method's wrong, and people aren't taking certain things into consideration. So I'm going to talk a little bit about methods as someone from the Methods Institute, but not too much, and certainly not enough to bore you. So in theory, this should be an easy question to answer. In theory, you look at the places that spend more money. Do they have lower rates of intervention? Or if money goes up, what happens to intervention rates? What happens to child protection plan rates? What happens to children looked after rates? In practice, I'm sure I don't have to tell a lot of you. Let me just scroll all the way down here. That it's not quite as easy as that, at least if you have a similar type of funding structure over there to what we have here. Over here, if you're a local authority that has a lot more intervention and you're a local authority that has a lot more poverty, that goes into the calculation for how much money you get from central government, so from central taxes rather than local taxes to spend on your services. So it actually becomes quite difficult because you have this reversed causality going on at least one level. If you're looking at Blackpool, for example, a very deprived city in England, they might spend more on family support services because they have more needs. It doesn't, and therefore they might have high spend and high needs. Doesn't necessarily mean that the spend isn't effective. So that's the central difficulty, really. You have potentially a different relationship when you're comparing across local authorities, which tends to be what we do when we're trying to figure out what's the relationship between things. We look at places and compare places to one another. We can't do that in this situation because we have this sort of funding formula, this reverse causality. So what we have often in analysis is something that looks a little bit like this. If there's more poverty, you get more child welfare interventions. I'm using that acronym for. But also you get more spending. But if you have higher child welfare interventions, that tends to increase the amount of money you get as well. What we really want to figure out is this. We want to figure out if you get more money, if you spend more money on family support services, if you can spend more money on services that provide childcare and all kinds of other things, by which I mean sort of not formal childcare, but things like your children can go to a youth club after school, you can spend a couple of extra hours at work, or you can open up what kind of work you can do because you're not having to find a job that fits with the school schedule. Does that have an impact on child welfare interventions? I'm going to tell you there's a method out there that you can do this if you have data on the same local authorities over time. It's called within between modeling. If you don't know what that means, don't worry about it. The basics of it are you're separating things into comparisons between local authorities, which for us aren't particularly meaningful, and what happens within local authorities when things change over time. So within Blackpool or within Sheffield or within Camden or wherever, what happens when spend is higher than what we might be used to in that local authority? Do the rates of intervention go up or down? So that's all I'm going to say on methods, but I'll link to the slides. And I try and keep everything in my slide deck in case someone wants to know about something, but that doesn't mean I'm going to go through every slide. So sometimes people watch the progress bar at the top and go, oh my goodness, there's no way this is going to be 40 minutes. I'm going to put my dinner on or something. So the other thing I want to say is I will tend to use the term effectiveness here, but what I'm talking about is if you invest in these services, do your rates of intervention go down? That's a very, very narrow perspective on effectiveness. And because I talk to all sorts of people about this research, I want them to know that that's not the only thing we should focus on. And there's lots of really wonderful and brilliant research being done by other people who can do it much better than me about things like the extent to which services are hearing parents and children's and other family members' voices, how well they're championing children's and human rights and challenging inequality and oppression, and lots of other things that aren't captured in the kind of thing that I'm looking at. And also we have, organizations like Ofsted looking at whether they're adhering to processes to make sure it doesn't matter where a child lives, they receive a similar service or a service that meets a similar standard. You will, I'm sure, have analogues to these over there. I looked at 3 outcomes. I looked at rates of children who we would call looked after. Those are children who are in foster care, in a residential home, sometimes in supported independent accommodation. Sometimes they can still be living with their immediate family. It's more common in some parts of the UK than elsewhere. But typically it means a child that's in foster care, but technically it means a child whose care the local authority is responsible for, so the local government is responsible for. It's been duty of care has been removed from their parents or their family of origin. Then we have child protection plan rates. Those are children who are subject to an investigation with a social worker, where the family is placed on a plan, and following that plan, the intervention may escalate into some kind of care arrangement, voluntary or involuntary, or they may de-escalate. And then we have the sort of lowest level of intervention, which is children in need rate. So those are children who meet a certain criteria under our Children Act, where there's an acknowledgement that their health or development will be impaired if they don't receive additional services. That one's a little bit more difficult to sort of trace outcomes with, because local authorities will be quite flexible with their interpretation of that legislation, depending on how much money they have to spend on things. So yeah, there's some interesting stuff there, but it's quite difficult to measure. And when it comes to preventative services spending, we have a few different categories, but not all local authorities will record all of their spending under the same categories. So usually the safest thing to do methodologically is combine everything. And fortunately, we can separate out the spending that is on what we would call safeguarding. Everything is related to safeguarding, but safeguarding in the spending context means money on direct social work. Our social workers here tend to work almost, I don't know, I don't want to make generalizations, but I would say almost entirely in a sort of child protection capacity. They do very little preventative work. That's usually outsourced to someone else who's not a qualified social worker. There's exceptions, but it's generally the case. And also not spending related to children being in care. So at the moment, it costs about £77,000 a year for a child to be in care. Your average child in care is about £77,000 a year, but that varies massively. So what we have left is spending on children's centres and spending for children under 5. We have the Sure Start programme, which I think you have an equivalent to over there. We have family support services, so those tend to be direct work with families, usually by a dedicated caseworker. There's controversies within some of that work. So some of that work is very community-led, but some of that work is very top-down, very sort of, well, we'll send someone in to whip this family into shape and get them into employment and make them responsible and so on. So mixture of things there. Then we have services for young people. So we have all of our youth work, our youth centres, any kind of youth work or youth centre that isn't like explicitly linked to a specific sport. Sometimes our sports department takes on those. And substance misuse and teenage pregnancy services. So I'm sure I can find you more examples if any of those aren't too clear. But largely they're places About half of those things are places where children and families can go, physical places where communities can gather, where they can do things, and about half of the money is spent towards direct work, sometimes linked to a place, but not always, or not often. I looked at 148 of our typical local authorities. I excluded City of London, Isle of Wight, Isles of Scilly, and then we have various other boundary changes that got reunified. And then I looked between 2009-10 and 2021-22. So that was our big austerity agenda. And I already talked about the method, so I can skip through that and go straight to the findings. So the shortest of the short versions is the evidence really strongly suggests that investing in these kinds of services reduces rates of children looked after and rates of children on child protection plans. The evidence around children in need rates is a little bit more complex, but I'll talk a little bit about that. I'm going to present this in a few different ways. Hopefully one of them sort of chimes with the sort of level you're interested in. So if you're thinking about a very local place, it might chime with that. If you're thinking about national policy, it might chime with that. If you're thinking about per 10,000 children in the population, every £100 per child we've seen decreased in these services was associated with about 3.5 more children being in care per 10,000 over the following 2 years, and about 2 per 10,000 more being placed on child protection plans. Children in need rates tend to self-stabilize. So if you put funding into the system, there tends to be a bit of a spike, bit of an increase in rates of children in need. As I said before, they can be a bit flexible with their threshold. So they lower the threshold a bit, a few more children receive a service. They might be receiving things like respite care that they're entitled to. But then the following year, the number tends to go down. So that implies to me that whatever needs those children had are being met, or any problems are being de-escalated. If you think about an average sized local authority in England, Sheffield's maybe a little bit larger than average size, but not too far off. That would be each £100 per child would be about 20 more children in care in an average size local authority. So huge moral, human, ethical cost, also very large financial cost, which we know matters when we're talking to policymakers and trying to make the case for these services. And about 10 more children, I wrote children twice there, 10 more children placed on a child protection plan on any given day of the year. So the caseload is about 10 more in that local authority on any given day of the year than we would expect. I don't know what an average social worker's caseload is. I know it's much higher than it should be, but that's probably a noticeable difference. If we break that down by where we saw our biggest cuts to services, the biggest impact this had was in 2011, 2012. That's when our coalition government came in. They had their austerity policy, their austerity agenda, and that's when most of the money was cut from these services. At the time, politicians were saying that these services had been protected under austerity. What had really happened was the total had stayed about the same, minus a little bit of, typical political trickery with not adjusting for inflation and so on, or not looking per capita. But the total had stayed about the same. But what was happening under the surface was more and more money was going into the cost of keeping children in care, and less money was going into the money was being taken out of the preventative services, and the safeguarding spending was going up a little bit, but staying more or less flat. If you're looking at spending between 2009-10 and 2021-22, at an average local authority, you can explain about 60% of the average increase in children looked after rates that we've had. So quite a big proportion, considering you're largely looking at just one predictor. That predictor is sort of blended in a little bit with poverty, and we'll unpack that a little bit in the presentation. And if you're one of those big national thinking people and you want to compare it to what else is going on in England and in the UK more broadly, if we had kept our spending at the same level as what it was in 2009-10, so when it was about £212 per child per year higher, we'd expect there to be about 8,300 fewer children in care nationally, which is quite a big amount. So that's about 10% of the number of children that were in care nationally. Nationally, I mean England. Yeah, that's about 10% of the number of children who were in care in 2022. We did have a care review in 2022. We had a children's social care review. The proposed increase in family support type spending was worked out to about £1 billion per year. In complete isolation, that would sound like a lot of money, but you can see here that's less than half of what our local governments, what our local authorities have lost since 2009-10. So it's great. That would, if that money materializes, that would be much better than nothing. but it's still much less than, it still might stabilize our growing numbers of children in care, but it's probably not going to reverse what we have happening here. When we include poverty and we accept that, if you accept that kind of inside the local authority, if the spending changes, it can help address poverty either indirectly through increasing employment opportunities or increasing the amount of work people can take on, or offering benefits maximization advice, or even creating some jobs as well. If you have children's centres, there's also jobs that need to be done there. Then you find that there's quite a positive impact on investing in these kinds of services for preventing child poverty as well. And that prevention in child poverty also helps and explains a lot of that earlier 60% of rates of intervention. So there is a much more effective visualization of this, I think. And this also really puts into perspective just how important poverty is. You cannot address growing rates of children in care without also thinking about child poverty, without thinking about families in poverty. So the orange slice is the predicted impact on, or the predicted increase in children looked after rates that we would expect from the average 3.7-ish percentage point increase in child poverty the average local authority has seen in England. So about 2/3 of an average local authority's change in rates of children who are in care is attributable to changes in child poverty. The green slices down here represent the change that can be linked to cuts in preventative spending. So it's by no means by no means an insignificant amount, but it's only about half of the impact that poverty has had. So we have this direct effect. So that's sort of, if spending didn't have any kind of impact on child poverty, we'd still expect about 1 per 10,000 fewer children in care for the average cut between 2015 and 2022, which is about £57 per child. But then we also have this dark green slice, which is the indirect increase. So it's about 1.5 children in care per 10,000 we would predict wouldn't have been in care, because spending on these kinds of services would have helped prevent or address child poverty in some way. And then at the bottom here, we have something that I'll unpack a little bit, where as time has gone on, us spending money on these preventative services has started to actually increase our lower levels of intervention, so our child protection plans and our children in need rates. But that's something that's started to happen after around 2013, 2014. So I have a nice little timeline I'll show you of that. But before I do that, I just want to talk briefly about the kind of cost savings, cost investment type argument. Because if you want to get this over the line with policymakers, they're going to want to know how much this costs, how much it saves, is it cost neutral, does it save money? It's an unfortunate reality, but I at least try to start this slide by saying, even if this kind of spending wasn't cost neutral or cost effective, it doesn't mean we shouldn't do it. We have moral and human costs of not supporting families, and you can't put a price on those. If you could put a price on those, I'm fairly confident they would outweigh any of the economic costs. But nevertheless, if we want to put an economic cost on this, let's say we increased all of our spending by £100 per child, so it's a nice round number, works out to just over £1 billion, which kind of nicely dovetails with the care review's recommendation of about £1 billion per year uplift in spending. If you looked just at the cost of children being in care where they could be living with their families safely, crucially, and you also looked at improved mental health outcomes and improved criminal justice outcomes, and I'm not being like what's the right word to use? I'm not being an idealist here. I'm looking at mental health outcomes changing from the average mental health outcomes for a child in care to the average mental health outcomes for a child who is living in a deprived household. So I'm not saying, well, these children suddenly, they go back to a middle class, very nice, well-funded lifestyle. I'm saying they're probably going back to living in quite a deprived, or at least on the cusp of deprived household. And similarly with criminal justice outcomes, the work by Anna Leyland recently, which I think this has either just been published or just been accepted, we're stepping down our expected criminal justice outcomes from those for children who are in care, which are really, really horrendous, quite horrendous, shameful, down to the criminal justice outcomes for children who have a child protection plan, which are also very bad, but not as bad. Those three very limited outcomes we'd expect to cover about 30% of the cost of whatever size investment is made, and that's within 2 years. So that's not these sort of very long run estimates that always sound very impressive, where you take into account what kind of grades the children get at school and whether they go to university and how many taxes they pay. This is just, in the next 2 years, what kind of other services won't be needed and how much would they cost. If you look at that child poverty effect, there were some estimates from our Child Poverty Action Group by Donald Hirsch, who's like very well-respected economist. I don't know if he self-identifies as an economist, but I'm not sure. But has been doing this kind of work for a long time, that you would expect about just over 3 billion of that 1 billion in spending to be returned through reduced child poverty. And I know my time's running out, so I'm just going to show you a couple of other things that I hope will prompt discussion, and I'll try not to focus too much on things that won't. The first one of these sort of quick fire findings is you can't just spend more money on social work to get around the problems that are caused by not investing in preventative and supporting services. This graph here shows the predicted impact on rates of children in care that we'd expect depending on how well funded the spending on prevention is for a £100 increase in safeguarding spending. So to put it a little bit in a slightly different way, if you spend money on direct social work, on safeguarding, and on the left-hand side, the minus 200, minus 100, if you do that in a local authority where it's just taken loads of money out of its preventative services, you would expect over 2 years, sorry, I think this is just in 1 year actually, about 7, I think that's somewhere around 7 more children per 10,000 to be placed in care that year. You're spending money on the safeguarding, spending money on the social workers. The social workers don't have any services to direct the children and parents to. All they can do is monitor that child and those parents. If you look on the far right-hand side, where you have a year where there's relatively well-funded preventative services, actually, if you spend more money on safeguarding, if you increase the number of social workers you have, if you decrease their caseload, it doesn't increase or decrease your rates of children looked after. I like to think that's because those social workers can then find the help and support that's out there that that family needs, and the family's able to access that help and support. So you can't firefight this with targeted provision. That's what England's tried to do. This graph on the left shows you in the green, all the way down for the preventative services in the orange, all the way up over time for the safeguarding services. Next bit, and then I'll start to wrap up. I think I'm more or less on time. I didn't keep track of how long the introduction was, but yeah, you can just cut me off if you need to. So what I mentioned earlier was over time things have changed. Not really for the better. This is what happens when you look at the kind of effect that we would expect from spending on these services at each of the levels. So on the top one is children looked after, and the middle one is child protection plan, on the bottom one is children in need. And the short way to read this graph is more green means more good. The more green dots there are, the more probable it is that spending on these services will reduce rates of intervention on average. So if we look at the impact of spending in 2009-10 on the rates of intervention in 2010-11, it's green across the board. And the green dots are, compared to a lot of the later points, a lot closer together. What that tells me is that the spending is having a similar effect across all of the local authorities in England. So it doesn't matter necessarily where a child lives as much, probably still does matter a bit, but it doesn't matter as much as in the later years. The services that get funded there are having a similar impact. And there goes the washing machine, so hopefully you can't hear that. But if you can, yeah, it's just a little intermission. So for these first few years that we have data on, we have effective spending for reducing rates of intervention across all levels. So across the sort of middle level of intervention, the child protection plan, across the children in need level, across the looked after level. And then we get to 2011-12's impact on 2012-13. And then we start to see lots of variation open up. The distribution of the points gets a lot wider. Children are starting to, or local authority spending is starting to have different effects for children's outcomes. This is around the time that our funding formula got revised in a way that benefited, or at least was less detrimental to more affluent places and was more detrimental to the poorest places. So previously we had a funding formula that probably wasn't perfect, but was an absolute funding formula, as in if the needs in that local authority doubled, then the amount of funding that it would be trying to allocate to that local authority would also double. The revised funding formula doesn't do that. As long as you're in the same relative position, you just get sort of a fixed piece of the pie, and then the pie varies in size depending on how much the government wants to spend. Then we have this period of a few years where spending isn't really very effective for reducing any kind of rates of intervention. And this is a period that I'll tell you a little bit about, and you can tell me, the panel can tell me whether you've had any kind of similar period of time. And then we have this sort of end of the decade period where actually some good news, spending on these services did tend to become more effective for reducing rates of intervention. It's kind of good news in practice because the funding was still getting cut. It meant that the funding for these services was needed more than ever, because if you cut the funding, then it means your rates of intervention are going to go up much more than they would have all the way back here. So that happened for children looked after rates, but not for child protection plan or children in need rates. Those stayed more or less, on average, pretty ineffective. So we're in a position now, or sort of approaching now, where our preventative services are really valuable for preventing children from going into care where they might be on what we sometimes call the edge of care. But there's not the kind of funding that's needed to bring those children all the way from reducing the worries that social workers have about them needing to be on a child protection plan, or reducing those very early baseline needs, those entitlements that they have under the child in need status. Little potted history, and then I'll start to wrap up. A few things that have happened over this very busy time. We had the publication of the Allen reports. Those were some reports that were focused on the first 1,000 days and early intervention. The reports themselves are reasonably fair in that they say this shouldn't come at the expense of services for older children, and this becomes relevant shortly. They shouldn't be funded at the expense of services for older children. It should be a both and type situation. What happens if you put that argument in front of local authorities and say you have to cut £5 million from your budget? Here's a report that says it's really important to fund services for children who are under 3 years old. And here's nothing that says it's important to give services for teenagers, or here's effectively nothing. What happens in practice is local governments cut funding for older children because they've been told the younger children have comparatively or receive comparatively better outcomes. And then we also have the infamous Troubled Families Programme, which is now called the Supporting Families Programme, which was a very caseworker focused, very sort of had a very strong blame narrative attached to it, and quite a big move away from community level interventions towards this idea of there are a few families who are troubled and we just need to go in there and take this kind of tough love approach to fix them out, sort them out. And then we have lots of other things going on, like what work centres, big focus on randomized controlled trials and so on. And again, community services, community provision really suffers on that. A little bit, I won't show you too much here. This just says that it's not necessarily the same across all of England. On average, it's good. Doesn't apply everywhere. But I just want to come back to that point about older children. and a little bit about community provision, because I think it would be relevant to the panel. If we try and break down the effect of spending on these services by age, so if we look by age, the further on the left the point is, the more of a positive impact spending on these services has. So for your children who are very young, it has a positive impact, but it's your 10 to 15-year-olds and your 16 plus year olds, your 16 and your 17-year-olds, mostly in practice, who were the most affected by cuts to services. So those were the children that were most affected. And it's their funding that's been cut the most. So not only is the funding the most important for them, but it's their funding that's been reduced the most. You can also break this down by gender. For young men and boys, the funding has a much bigger impact than for young women and girls. It still has a notable, a significant impact for both, but it's about twice the magnitude for young men and boys. That may have something to do with the kind of needs for services that young people have. And then the last one I'll show you is the breakdown by ethnicity. So these are sort of very imperfect, large ethnic groups that the local authorities have to publish data about. If you go any more fine-grained data than that isn't publicly available, you can request it, but most of it in a lot of local authorities will be censored because there's quite a few children. So it's far from perfect, but what you can see is a pattern that it is, while children across all ethnic groups in England benefit from investment in these services, it's the children from minoritised ethnic groups that benefit the most. So they receive proportionally more than twice the benefit. And especially if you're from the other ethnic group, which includes, this one's a little bit more difficult because there's quite a lot of missing data. But yeah, there's very strong association between those. And if the last thing I'll say is something that's not in my slides. So if I just bring it up very, very quickly. If we did a breakdown of those categories I told you that made up preventative spending, there's 3 major categories and an other category. 3 major ones are Sure Start, children's centres and services for under 5s. Those are largely community provisions, like places where mothers with children can go. Usually, I say mothers because it's usually mothers, but it can be fathers as well, to receive help, support, some childcare or help with childcare, and so on. Then we have those family support services. So those are the kind of troubled families program, the direct work with families, the casework with families, that's not social work, child protection. And then we have the young people services, the youth work, the youth clubs, the youth centres, and so on. The Sure Start and under 5 services have been reduced since 2009-10 to 2021-22 from £1.84 billion all the way down to 510 million. So almost down to a quarter of what they were. They used to make up about 40% of our spending on prevention. Now they make up about 20%. Our young people services, our youth clubs, our youth work, used to be about 1.25 billion. They used to make up about 27% of what we spent. They're now all the way down at 420 million pounds. So again, they've been cut to about a third of what they were. They only make up about 17% of what we spend our money on now in England. But our family support services have gone from £1.07 billion up to £1.44 billion. They now make up almost 60% of what we spend our preventative services on. So if you think about that timeline and the effect of spending getting less effective, and then just more effective for the more acute, more critical, more crisis type level of intervention. Um, some of it starts to make sense in the context of we have really, really, really massively reduced our community provision and our physical places and spaces, especially for older children, where people can go and be part of their community, in favour of a much more direct casework. Family and family focused makes it sound like a good thing, but I'm going to problematize that by saying it's not necessarily a good thing. So I'm going to stop there. I'm sorry, I think I'm about 5 minutes over. I hope that's okay. And I think Everly told me to pass directly on to David. I don't know if David's prepared. I sort of stopped very abruptly there. I'm afraid I'll stop sharing so everyone can see the panel, if that sounds okay. And maybe we can hold questions till the end. Does that make sense? Okay.
Oh, well, thank you, Callum. There's a lot of bells were ringing, and obviously it's a data-rich what you've done. You've synthesized a lot of data and got some big patterns. There's a part of me that's sort of still trying to process some of the numbers, so I'm not going to go there. I'm just going to step back more and just make a general comment. Just some reflections and that. Some general comments to start with, where one is, I mean, we're going down a social investment approach is sort of the holy grail in our political system at the moment. And they tend to be saying they're very about big data sets and all that. And my thought was, I just hoped they used the same sort of analysis or your evidence that you were building to inform that data discussion. I sort of doubt it, but I'm not close enough to that. And I know Len Cook is on this call, and Len is a statistician, is the ex New Zealand and British statistician, will be making some good sense of this. So I look forward to talking to you later, Len, about what Callum's presented. Well, like so I'm in an organisation, Wesley Community Action. For about 28 years, we ran care services for people in the care, what they call high and complex needs. So we had residential care and we had foster care. So we were at that end of the spectrum. We have contracts like Family Start, which would be prevention for largely mothers, but with young families and babies that were experiencing stress. And then we've got another leg of activity, which is community driven, and that. So sort of I'm commenting across those sort of three strands, which I think some of that correlates to what you included in your research. Firstly, to say what I think every probably person on this call knows, even those people that are in Oranga Tamariki, is that the system severely stressed is almost an understatement. My limit bit of reading into trauma is we've got a traumatized system. So it's really hard. It's such as the stress been on it and the constant restructure and change, and that it's at all parts of an organization to have a degree of functionality, it is struggling profoundly. So that obviously flows through into organizations like ours when we're trying to understand what they expect, what the contracts are. I mean, they're just in chaos. So, largely it's always been stressful. In that sense, it hasn't changed. But what's sustained the good work that's been able to happen is often key relationships with people within the system. And we know each other and we all know the sort of limitations and all pressures, and we can sort of creatively problem solve, sometimes around the rules of the system. And because there's been a degree of continuity, you can build those relationships to try and navigate in that. Well, that has largely broken down. And so there's sort of the high churn of staff. And then the staff that we do talk to, invariably they'll go say, can I have a talk off record? And they sort of offload to us about how hard it is for them in the system. And so So we're very much one system. And in that environment, it's really hard to have an idea of data, patterns, and trends. Certain sort of information is publicized or talked about by the minister and some figures, but I don't really know how to take those because the system, it's just like plucking a few key result areas or indicators without an overall sort of understanding. And certainly, we've had waves of reductions, like the Family Start. I think someone else is on this call who's very heavily involved with Family Start. That the process of reducing. So we had a 60% reduction in our contract. So we had 10 staff working full time on this Family Start, which sounds like your sort of Sure Start in a sense, and that went down to 4 staff. And there was no logic or no data. We were told that there's no cut to frontline services. It's back office, and there's this various sort of political rhetoric. And we said, well, that's a big cut in this community. That's a big service coming out. And then the discourse was, well, we've got costs in other part of the system that we need to sustain. So it's like the almost an impact of inflation of having young people in care. They talk about focusing on the 5,000 in care. They've got to focus on that, So in this organisation, in its really difficult situation with its budget being cut, it's been having to move money around to sort of cover what it's describing as its core. So this concept of preventative has been radically eroded. So in terms of, so we've made a big decision. We as an organisation walked away from intensive foster care and the residential care at the high end because we got to the point where sort of the system was so dysfunctional. We didn't have confidence that we were making a positive impact in the young people in our care. In fact, we were almost like re-traumatizing the children because of the way that the system was operating and decisions were being made. And we said, what are we doing, if we're part of the system, part of the problem, it's not healthy enough. So we then sort of started an innovation process saying, well, we've got knowledge, we've got care. What could be something, how else could we use our skills in a way outside the pattern that had formed, which was just not going anywhere. So we've been trialing some different approaches and all that, and on the one hand, we think there's some really so we'll talk about whānau-led or community-led. So it's a lot more rather than moving very much away from pathologizing the family, using their reality, their experiences, what they want to have happen, backing them. There's no conversations about them between professionals without the family in the room or knowing about it. So we're trying to really go down that approach. We think we're getting some good gains and all that, but the system is saying it. The workers in OT are really valuing what we're doing and that, but there's no money. So I've accepted that because I could bang the drum and say that. So I'm going to have a crack at the social investment model to see if there's funding from other portfolios other than just child welfare. I mean, that may be a waste of effing time, but we'll see. The other thing I'll just make, and then I've just got just a minute or so left, is that one of the things I'm noticing is what I don't know how to describe it, but it's sort of like informal community systems that we also are the backbone for are really taking off in a big way. So we've got initiatives that work with what we call club whānau. So they're gangs. So it's the Mungo Mob, Back Power. So we've got this sort of social groupings of people that have experienced trauma, initially from abuse within the care system, and they've developed whānau systems and an identity. They're politically obviously in the spotlight because they call them organised criminals. Well, there's people within those communities that have got a very strong pro-social focus, They've done enough on their own journey of processing their own trauma to know what needs to happen to let go of that. They're weaving neuroscience and emotional intelligence, and they are running workshops around the country and getting massive uptake and people in there because they're saying we don't trust the system. The system has always abused us and treated us poorly. So we need to take the knowledge, the sort of the tools from social work and neuroscience, put it in our own language, and we've got to teach ourselves. So it's it's almost like a new system emerging outside the structured system, and we backbone that. So that's incredibly powerful. I don't fully understand it all because it's so emergent, but I just want to note this on the panel because I think it's a part of the creative way going forward. So I will stop there. And yeah, stirred up a lot of really helpful stuff, Callum. Thank you very much. And I'm supposed to pass on to, I think it's William. So yeah, William, I'll pass the rākau over to you, William.
Kia ora, Dave, and kia ora tātou. Firstly, just acknowledging Kerry for our opening earlier and the welcome, and to all of our guests here, particularly Callum. Thank you very much for your kōrero. So my name is William Kaipua. I am the CEO of a little organisation in the north called Taitumu Taipari, born out of the need of Māori Providerville. And what many of our Māori providers here in the north have realised is that there are a lot of demands on their time for response to things like government policy changes, papers, all those sorts of things that people are wanting their opinions on. But Māori providers here in the north, their role is about providing service, like David talked about, providing services to our people. So they are not necessarily designed to have capacity and capability to be able to respond when government asks for comment on policy changes or those sorts of things. So what I've got here is I've got a small team of about 10 of us, built-in IT function, built-in data analysis function to be able to take a good look at some of the things in front of us and respond accordingly. Now, part of our ethos here is about how do we change the system so that if our whānau ever have to go through it, they come out of it better for the journey, rather than battered and bruised and beaten by that system. And so our primary focus is on challenging, at the moment, the oranga tamariki system and also the courts system. By invitation, those organisations, ministries have invited us into having a look at their systems, how they currently work, and how we might be able to find a better way for those things to be done. So I represent a community voice. So, love the stats, but am challenged by the whole academic world. Thought I wanted to be in there, but yeah, I'm not sure I am. But I can also add some context to what's previously been talked about, which is similarly to your austerity policies, this government or previous governments around the 2013 to 2015 started to introduce similar things. Now, I know this because I was working at the time in government ministries in procurement. And so to Dave's point around they reduced spending on certain programs, what we actually did by direction of government was we shifted that resource out of those programs into whatever the initiative of the day was. And so you had government thinking that actually, let's create these things they called children's teams, for instance, which was about shifting resource out of the early intervention prevention space, which I hand on heart wholeheartedly believe in, and thought, well, actually, let's drag that resource further to the statutory space, and they bounced around the statutory line, which bounces anyway. And they said, well, actually, let's invest in these things, and we will start to address what we believe the problems are. Now, in the meantime, poor old early intervention Preventionville, the communities out there that sit in the back blocks of Taitokerau, for instance, they had further reduced resources. But here's couple of things I will say that resonated out of your kōrero, and this is my response to them, is despite the situation, the very first people who are affected by whatever this government or any governments do in terms of their policy changes are poor people, low socioeconomic, vulnerable whānau. They are the first ones to feel these effects. Now, if we have a look at what our government's up to at the moment, they're beating up poor people, they're beating up women, they're beating up their own bureaucrats, cutting them and saying, see you later. So what are they up to? They want to supposedly deliver a fiscally responsible term. And how do they do that? By sucking all of what they term spare resources back into government and going, hey, look, we saved all this money, pat on the back. But in the meantime, all they're doing is creating worsening situations for our whānau. And the bit I was going to say earlier was that our whānau, they will survive no matter what. They will find ways to survive, and it's our role to find ways to support them. That situation's only getting worse out here. Our whānau, the deprivation is just growing, but no one seems to be really interested from a government perspective. So what we're trying to do is we're engaged as one of the enabling communities partners here in Aotearoa. We're one of 9, might be 10 across the country, which is part of the government's devolution, decentralisation of oranga tamariki and the so-called child protection system. So what I've proposed and my team have proposed, and it's up for review with oranga tamariki at the moment, is actually let's give us a shot at the sites in our community and let's see how we can change that system. Now, what I want to do is I actually want to push more support, more resource, and more thought into the early intervention prevention space. Because if we can just imagine the tap's on full bore for oranga tamariki and these children, there's a plug in the bottom of that bath. What's going to happen if that tap is not turned off? That bath is going to overflow, which is what I think David was alluding to before. And we can't deal, or this current government can't deal with that overflow. So my question is, how do we turn that tap off ultimately? We're going to struggle to get there. But in the very least, how do we turn it down? And I think it's through early intervention and prevention mahi that we can all do. And so reported concerns, for instance, some of these reported concerns don't get addressed. They don't get looked at. And over time, they stack up and escalate. My view is if we, the community, can engage, because the government calls it no further action required, if we can engage early and say, whānau, what sort of help do you need? That might stop them coming in at the more serious end. So that's what we're proposing to try. And, I believe everyone out there on this call and others are working their best to try and slow this down, but I'm not sure this government is really supporting that. And despite, I think, some good messaging coming out, I think this current minister in that space is probably a little bit hamstrung or hands tied. And yeah, I'm also really interested in that social investment approach. I was part of it when they first formed, and what that was essentially built on was those child vulnerability factors. And they picked 4, mum or dad had a criminal conviction, were on a benefit, so high likelihood of these things happening. Now that did its thing. They didn't like it, one government, and now this government likes it, so it's coming back. I would, I suppose, put a word of caution there. Yep, it's going to be data driven, but it's got to be connected to the reality of some of our whānau on the ground. We can't do this without considering what Dave and them are doing, sitting with some of those parts of our community that we don't necessarily want to sit with, like the gangs, like the real hard to reach parts of our community, because they're all part of that solution too. So, I had a lot to talk about, but this is the tack that ended up coming out. That's my 10 minutes, and I don't want to steal any more time from Jane, but thank you very much for the opportunity, and thanks for your kōrero. Kia ora tātou.
Kia ora koutou, everyone. Thank you, Callum, for sharing that information. That was, it kind of feels like a no-brainer, but it was really good to have to have that evidenced. And it just struck me how poverty, it's not just the reduction in services, but it's also the poverty that makes such a big difference. That's really good to have that evidence, basically. So I'm the practice manager at Anglican Family Care, and also involved in the Family Start Collective. And so the Family Start Collective, it's a voluntary evidence-based program, and it works by way of intensive home visiting, and it focuses on improving children's outcomes in health, learning, relationships, family circumstances, environment, and safety. Unfortunately, as part of the cuts last year, there was a 27% Family Start cut across the country, and David spoke to that. And so that is, I think, having a ripple impact across New Zealand. And it is frontline workers who have been made redundant, or luckily in some cases shifted to another part of their organisations. I think the effects of the cost of living and these cuts are now coming to roost. If you look at the Salvation Army's State of the Nation report, poverty is rising up again. And last week, Oringa Tamariki, it came out in the media that their reports of concerns have risen by 45%. So that's quite evidences, in my mind, that reflects Callum's research, that if you were to apply it here, that seems to be happening. And there's more child poverty rates and children being hurt, frankly. So what else was I going to say? So, David, I also share your frustration around kind of the lack of communication from our funders, or about what they want either, or how they're working. It's been quite a frustrating time talking from my perspective as a provider and working with other providers. The uncertainty doesn't help. It doesn't help our workers, and it doesn't help our whānau. We work relationally, and we kind of know that that's the best way to work with people. So we do need the funding for us to be able to do that work. What we need is consistent funding. I'm not opposed to the social investment approach, and I am in evidence-based. We're totally behind all that. But it would be good to know what the government actually do want, and it is a very confusing time. Or a very disheartening time, I guess, when when the government are more focused on budgeting than on services for people. I think people have been totally missed out. I think, and that's where the impact. We try not to put reports of concerns in willy-nilly. We're very considered on whether we do or not, but I just think of a small town that we work in Otago. Last week we put in 3 reports of concerns, and we don't do that lightly, but there was significant family violence and meth use, and yeah, so I think things are tracking up the wrong way, but what we totally need is certainty for the sector, and early investment. It just seems like a no-brainer. I am not sure what else I'm going to say, so I'm going to leave it there and leave time for people to have questions.
Te pai, Jane, and thank you to everyone who's contributed to this rich discussion. I mean, just the range of perspectives has been so valuable, and just hearing very loudly that message of both the impact on our whānau being so deleterious, but at the same time, the sense of resistance and creative responses as well, at the same time. I will throw it open for questions. Ayal, I see you have some quite technical methods questions, which I also am interested in. I wondered if you wanted to stay on the call for a minute or two after we actually finish, because Callum and anyone else who's interested in those methods questions could hang around a little bit. Thank you. Yeah, I know your work, Ayal, as well, so I'm interested to, see your view around that. But would anyone else have a question for either Callum or any of our panelists? Just go for it. Don't be shy.
This is not for the current people who have spoken, and again utterly challenged by this. Len, any comment at all on this in terms of comparisons between the data drill down and what we look for here and what Callum has stated at the beginning?
Right, gosh, I'm a bit embarrassed to speak in this company, given the fact that I don't have much experience on the ground. Can I say, I think we have to be very wary with tools like the social investment model, and it's based on data that the Crown has collected for quite different purposes, much of it. Anything that we develop as a model, even I suggest Callum's, have to be tested on the ground in terms of how do people on the ground actually see, is this actually happening? And I think one of the critical things as we move to a more, shall we say, data-driven approach by people at Molesworth Street, it's increasingly important that we actually test what we're doing. But can I just add one thing? I keep coming back to that period from about 86, 87, when the number of children in care went down from about 7,000 to 2,000.
Yeah.
And we kept it at that level until about 2005-6, when the whole system seemed to change again. And I wonder whether we think enough about what's going on in the institutional mindsets. For example, remember the Kahui twins, suddenly we ended up with an extra 1,500 kids in care for a couple of years. Do we need to really enrich the way in which people from community organisations are able to challenge, understand, and get on top of the modelling that's actually done and see where it actually fits in terms of what's missing. I mean, the big thing that statisticians face with models is missing variables. What's actually really critical, but is what is not included in the model. So I suppose that's just my comments. I just sit there and I mean, just even things like, has the mix of children in foster care versus institutions changed? So I suppose I'm really, I shouldn't say any more because of my limited knowledge of what goes on compared to the rest of you. But that would be my comments from, say, the back room.
Thank you. Thank you.
I think if I can come back on that just a little bit, because I think it's really interesting and it's really important. I guess if I made it very short sort of reflection on some of the challenges, sort of, trying to read through the methodologies of what some of the people are doing, especially when you read through some of the audit office methodology, it's like you're having to read tea leaves to figure out what they did, and you just think, just tell me, just show me what the model was. But it's obviously my model's not so much in the presentations, but in the report, it's very transparent. But I think there's, in the sort of data-driven approaches, my big worry is that there is, more data, more models, but less theory. There's far fewer people thinking about, how does this change the substantive meaning? If I include this variable versus exclude it, if I use a dynamic model versus a static model, how does it change what it means? If I'm removing trends from my analysis, or what does that what does that mean? What does that imply? What do we need to know about that? And I guess that's the thing that always is the challenge to me. So yeah, it's good to hear your reflections as well, and I think some of that speaks a little bit to some of I'm not sure if it's AL or EL, the questions in the chat as well. But yeah, it's all of these decisions in model building, and none of them are neutral. There's no best model. There's just a model that tells us something about what's going on, be it right or wrong, and we kind of have to think about it to figure out how it helps.
Absolutely. Absolutely. Thanks, Callan. It's great to have someone like yourself who is able to do that kind of meta thinking and present your data in such a way. I mean, it is so interesting, but realizing the tentative and partial and contingencies that are built into it as well. And I appreciate that in your presentation. We are out of time, unfortunately, so I will now ask my colleague Shane just to close for us. And again, Cal, if you did have 5 more minutes and wanted to hang around with AL and anyone else who's interested in those methods, do feel free. So thanks, Shane. Shane, you're on mute.
Kia ora koutou. I've somewhat scared, fearful, all those kinds of things. What I thought has really been confirmed. The daily experience of all of the speakers in their mahi has also been confirmed by Callum's mahi. But just before I say my karakia, I just want to mihi to everyone on this call. And I'll wrap it up in a comment that's attributed to Seamus Heaney. Hope is not optimism, which expects things to turn out well, but something rooted in the conviction that there is good worth working for. To everyone here who is spending their day working for the good of others, ka mihi aroha kia koutou. He karakia kua mutu. Hā ki roto. Hā ki waho. Kia tau te Māori e kokiri nei. I ngā pike me ngā heke. Ko te rangi Māori e taku e rapu nei. A tihei Māori ora. Kia ora.
Kia ora.